So we're going to talk just a little bit about the skills necessary to engage in consultation. You have to obviously have more skills than the level of your consultee. And you have to go about this in different ways. So you can't just tell somebody what to do. It's similar to a counseling relationship that you have to kind of talk them through and maybe ask the right questions. You want to come into this too with the idea that your consultee does have some knowledge about the situation and that they can help you with that. So obviously, you have to have some level of expertise in the presenting problem that they're bringing to you, and you have to understand how this process works in order to move the consultee through the different stages of a consultation. Um, you may need some training and teaching as a part of the process, that you are training your consultee and you're doing some teaching as well. So you use your power of persuasion to influence the change. You have an expert power, you have a legitimate power, and you have a referent power. So, in looking at this, we often use a stage model, and the stage model just provides kind of a framework to make sure that you go through all the necessary steps and you don't leave something out. So, the first thing would be, and this is Daughtry's four-stage model, that you would have the entry stage, and that's basically where your consultant is just telling you about the problem. This is what's going on. This is where I need help. This is what I've tried. And give you the opportunity to ask some questions. So then in stage two, you kind of diagnose what the situation is. What are the needs? Sometimes it may even be in diagnosing a client. And then you explore the problem more. The third stage would be when there's an implementation and you select the course of action. So in the role of a supervisor, this would be when your supervisee goes back out and they follow through with what you discussed in supervision, and then they bring that back to you. And then the final stage is that disengagement, that handing that problem over to the consultee. Now, obviously, if this is supervision, that doesn't occur until the intern has completed their supervision process. But there are times fully licensed people go in for supervision as well. If you're at a point where you're working with a client that you don't have a lot of expertise with their particular problem, or you have concerns about your ability to be objective, that there's some countertransference going on, then a fully licensed individual could go in for consultation and supervision as well. So there's two types of consultation: from the consultee or the client-centered. This is a case perspective. This is what happens a lot in supervision. And then a program-centered, where you're looking and evaluating a program, not necessarily an individual aspect of it. I serve as a consultant for universities who are getting their CACREP accreditation for the first time or going up for reaccreditation. And so I go in, I evaluate their program, and kind of give them an idea of what things might need to be changed or improved in order to get their or keep their CACREP accreditation. There are times that we consult with other mental health or medical professionals. A good counselor has a consultation group. I have 3 other professors that if there is something that I think, I just kind of want to get somebody else's idea or opinion on this, whether it be with a client or with a supervisee, because we all supervise interns, then we talk to each other frequently with that. Mr. Patterson was our former clinic director before Amanda, and he was amazing at ethics. And anytime I had anything that was ethical in nature, he was the one that I went to, because he really did a good job of walking through that process and thinking about every aspect of an ethical situation. So some of the challenges are, it requires extra time commitment on that person. You may be intimidated by the process. You may feel like that it makes you feel vulnerable. that's how we grow as individuals. You need to be able, and as professionals. Um, if you're consulting with medical professionals, then you may be a little bit intimidated by that medical culture. And understand that, let's say that you're consulting with a psychologist or a social worker. We come at these things differently. And so there's going to be a different emphasis on theory, on how we go about addressing information, learning information, and problem solving. And so sometimes that can be a little bit of a challenge if it's a multidisciplinary consultation. But most of the time, we learn a lot from those individuals. Other challenges, or there may be some confusion or misinterpretation uh, of the role. There may be a power differential. When I worked in the hospital setting, the doctors had more power than the therapists did. Again, that was a situation where the medical model was dominant. Um, you may feel that they're devaluing the relevance of the profession from a counseling standpoint. Uh, we we really can't accept being governed by other models. If you're working in a medical model and you don't feel like that is congruent with the work that you do, then you may have to just work within that, or you may have to challenge it. And sometimes there's just competition between other mental health professionals. Um, Psychologists, counseling psychologists especially, they think they're counselors, and they don't understand that they don't look at things in the same way that we do. And that doesn't mean that they're not counselors. They see themselves as one of us, but when we are working with them, we see the differences in how they interpret things. This often happens in treatment teams, that in this situation, the client's wellness has to be the primary concern. Uh, you only involve people if it's going to be effective and if they have an interest in being involved. And just knowing that the more people that get involved, the more opinions and ideas you have, that can be good. Sometimes it can become a little bit cumbersome. Uh, but most of the time, a treatment team results in an advantage for a client. And that goes back to that integrated behavioral health model as well that we talked about. So with this, you're going to seek out, let's say that I'm working with a client that, they've been on medication for a long time, and I'm seeing maybe some concerns about the medication, or I feel like that they need to be on medication. Let's say that I have been working with someone and I feel there's a need for them to be on medication. So then I might consult with a medical doctor using that four-stage model. You want to maintain the client confidentiality unless you have a release of information that you can have that. If there's anything that you can do to help decrease costs or hospitalizations, that helps. And then you also are improving the outcomes for your clients. Consulting with families, you use a lot with parents or with somebody who's severely ill. And it's basically you're just going through the same type of process. If you have an adult that is chronically mentally ill, it's not unusual to be working with a parent or with other family members to help them maintain their health and maintain a recovery status, prevent any type of relapse. If you have somebody who has a personality disorder, you may be working with families to help them understand how to manage that disorder and not get caught up in the symptoms of the disorder. Anytime you're working with children, you're going to be working with parents. And so you want those parents to understand part of it is that they can't expect to continue to do the same things they've always done and see changes in their children. That if they want something to change in their children, they're likely to have to change as well. Challenges with working with families, the family's in charge. They have whatever plan you put together, they have to have the ability to implement it. And so you're kind of serving as a facilitator or advisor. And you want to think about who else may have influences. In working with families with children, you never ever want to undermine the authority of a parent. For community members, you can have a triad where you've got a consultant, a client, or consultee, and stakeholders. Different places this occur could be in the schools, community-based agencies, or mental health policies, and you're going to do the same thing, 4-step process. Looking through that system definition, system assessment, intervention, and evaluation. You're doing that at the system level for this. When you're having clients transition from different levels of care, so maybe you have somebody that is going to go into a hospital setting, you've been seeing them individually, and they've decompensated, and so you feel the need to recommend a hospitalization or partial hospitalization, something else. Maybe you want to bring in some other type of treatment. I'm an EMDR trained therapist, and sometimes somebody who has a client that they believe could benefit from EMDR, but they're not trained, will refer to me just for the EMDR, and then I provide feedback as to what happened in the EMDR session, and then the other counselor may process that. So you want to determine what's the level of care. You want to be sure that you're providing the standards that are in line with locus and colocus. That those are governing bodies, that standards of care that talk about appropriate levels of care, and you want to look at the specific interest level for that. In looking at some of the legal and ethical issues, you want to be sure you have a clear and comprehensive contract. If there's individual responsibilities, you want to be sure that, you understand if you're serving as a consultant, you take on some level of liability with that. And then understand what the legal constraints related to courtroom testimony and confidentiality. Counselors do not have you're not guaranteed privilege in a courtroom. It's only if the court agrees to allow you. And if the judge says you got to talk, you got to tell things, you got to talk, and you got to tell things. So that's just a little bit of information about consultation. Again, one of the best things that you can do is have a consultation group. Having a consulting with others is one of the greatest protections that you have in liability cases. If you can say, I consulted with these 3 counselors on this date at this time, and this is the information they give you, then it can be determined by the court that what you are doing is the traditional standard of care within the profession, and that's a good protection level. Okay, we'll go on to the next topic after here.